Medical termination of pregnancy refers to the intentional termination of a pregnancy using the medication or the surgical method legally permitted under the specific condition governed by the Medical Termination of Pregnancy Act, which sets the legal guidelines. Indications for MTP: maternal indication, risk to the mother's physical or the mental health, severe maternal illness, cardiac disease, cancer, and severe infection. Fetal indication: congenital anomalies incompatible with life, anencephaly, severe cardiac defect. Genetic disorders like the Down syndrome, thalassemia major. Social or the economic reason: failure of the contraception, mental or the financial inability to trace a child. A for insect, unwanted pregnancy resulting from the sexual assault. Legal provision MTP 2021 up to 20 weeks. MTP allowed with approval from one doctor. 20 to 24 weeks allowed for the special case. If survivors, innocent victims, fetal anomalies with approval from two doctors. Beyond the 24 weeks. Termination allowed only for the severe fetal abnormalities decided by the medical board. Consent: alleged women, only her consent is required. Minor or mentally ill women, guardian consent is required. Methods of MTP: medical abortion up to 9 weeks gestation. Drug use: mifepristone, antiprogesterone 200 mg orally followed by misoprostol, prostaglandin to 800 mcg vaginally orally after the 24 to 48 hours. Mifepristone blocks the progesterone, causes the residual breakdown. Misoprostol induces the uterine contraction and expulsion. Success rate is 95%. Side effects: bleeding, cramping, nausea in the area. First trimester up to 12 weeks. Manual vacuum aspiration or suction and evacuation. Second trimester 12 to 24 weeks. Dilution and evacuation. Induction of labor. Misoprostol or the oxytocin. Complications of MTP: medical abortion, heavy bleeding, incomplete abortion, requires a surgical evacuation, infection. Surgical abortion: uterine perforation, hemorrhage, Asherman syndrome, intrauterine adhesion. Post-abortion care: monitor for the excessive bleeding or the infection, counseling on the contraception, IUD, OCP injectable to prevent the unintended pregnancy, psychological support if needed. MTP is legally allowed under the MTP Act for the maternal, fetal, social, and the rape of infant-related reasons up to 20 weeks, requires one doctor's approval. 20 to 24 weeks requires two doctor approval. Beyond 24 weeks, only for the severe fetal anomalies approved by the medical board. Mifepristone and misoprostol is used for medical abortion up to 9 weeks. Surgical method: MBA lesser than 12 weeks, DMP 12 to 24 weeks. Complications include the hemorrhage, infection, and complete abortion. Post-MTP contraception counseling is essential to prevent the repeat unintended pregnancy.